Welcome to Module 2 of the Introductory Training Program on Cybersecurity for Healthcare Staff. This module consists of 2 lessons and will focus on the General Data Protection Regulation and its implications for healthcare workers. In this module, you are encouraged to familiarize yourself with the General Data Protection Regulation, in short the GDPR, which we briefly mentioned before in Module 1, and its relationship with cybersecurity in healthcare. Healthcare workers play a crucial role in handling and processing patients' personal data, and the GDPR has introduced important changes to how this data should be managed. In this module, you will gain an understanding of how the GDPR affects your daily work in terms of patient data protection under the GDPR. You will hear about the principle of transparency, which is important in complying with the GDPR, and learn more about what actually constitutes sensitive patient data. You will also learn about what compliance and accountability, as well as data protection by design and default, mean in the context of the GDPR. And finally, you will find out about what you can do in case of a cybersecurity data breach. In the first lesson of this module, we will focus on the purpose of the GDPR, the principle of transparency, and building on the first module of this training course, learn more about what sensitive patient data means. As a first step, let's look at the purpose of the GDPR. The GDPR is a comprehensive data privacy and protection regulation that was enacted by the EU and became effective on May 25, 2018. It was designed to harmonize data privacy laws across Europe, to protect and empower all EU citizens' data privacy, and to reshape the way organizations across the region approach the data privacy. While the GDPR has broad applications across various industries, including healthcare, its primary purpose is to strengthen individuals' data privacy rights and impose strict rules on organizations that handle personal data. Because the GDPR aims to protect the personal data of individuals, including patients, it shapes the way you, as a healthcare professional, deal with patient data such as medical records, health information, and other sensitive data related to your patient's health. Now let's look at some of the key principles of the GDPR for healthcare. In this lesson, we will focus on the principle of transparency. The principle of transparency is one of the core principles of the GDPR, and it plays a crucial role in ensuring that your patient's privacy rights are respected. During your daily work, you often collect or record patient information as part of your routine duties, such as medical history, vital signs, and treatment plans. One of the components of the principle of transparency is that patients must be provided with clear and concise information regarding the processing of this personal data. This information should be easily accessible and easy to understand. It typically includes details such as the purpose of data processing, the legal basis for processing, the recipients of the data, and data retention periods and the patient's rights under the GDPR. In this context, a very important component of the principle of transparency is that patients must give informed and explicit consent for their personal data to be processed for specific purposes. This is called informed consent. Healthcare providers should clearly explain why the data is being collected and how it will be used. And patients should have the option to opt in or out. In other words, they need to be informed about how and why the data is being collected, and that they can choose to consent to this or not. At times, you may need to access and share patient data with other healthcare professionals as part of their patient care. Patients have the right to be informed when their data is collected from third parties, such as referrals from other healthcare providers. This ensures that patients are aware of how their data is shared within the healthcare ecosystem. The GDPR requires that data sharing is done on a need-to-know basis, and that patient data is not shared with unauthorized individuals. Another component of the GDPR's principle of transparency is that patients have the right to request access to their own healthcare data and the right to request corrections or deletions of inaccurate or outdated data. Additionally, the GDPR specifies how long patient data can be retained for various purposes. You should be aware of these various retention periods and ensure that data is not kept longer than necessary. Now let us take a closer look at the term sensitive patient data. Perhaps you will remember that in the first module of this training program, we defined this to refer to identifiable health-related information that, if exposed, could harm the individual patient. This includes details like diagnosis, treatment records, and prescriptions. Why is the way which you deal with sensitive patient data important for your work? Let's look at some possible way in which your actions in dealing with this data could potentially breach the GDPR. Imagine you're a hospital receptionist who handles patient registration and administrative tasks. One day, a patient comes in for a routine checkup. During the registration process, you ask the patient a series of questions, including some related to their health history and medical conditions. You enter this information into the hospital's electronic record system without obtaining paper consent. Another possible mistake might be if you fail to inform the patient about their rights under the GDPR, including their right to access their health records, request corrections, or withdraw consent. Another mistake that you could potentially make when dealing with different types of sensitive patient data might be accessing a patient's genetic data without a legitimate reason or proper authorization, violating the patient's privacy and GDPR requirements. Another mistake might be accidentally or intentionally disclose a patient's sexual orientation to unauthorized individuals, violating the patient's privacy and potentially leading to discrimination. Similarly, you might ask intrusive or unnecessary questions about a patient's sexual orientation without a valid medical reason. They're just some of the mistakes you can make in dealing with sensitive patient data. So as a first step, let's take a closer look at what data constitutes sensitive patient data. Sensitive patient data is known as special category data under the GDPR, and it refers to certain types of personal information that are considered particularly sensitive and deserving of enhanced protection due to their potential to harm an individual if mishandled or disclosed improperly. Because you deal with sensitive patient data, you should have a clear understanding of what constitutes this type of data under the GDPR. First of all, there's health data. This includes details about a person's physical or mental health, medical history, diagnosis, treatments, prescriptions, and any other information related to their healthcare. This can encompass information collected during routine medical examinations, hospital stays, or treatment plans. Then there's biometric data, which includes unique physical or physiological characteristics of an individual, such as fingerprints, DNA, or iris scans. In healthcare, this could be relevant for patient identification security measures or research purposes. Thirdly, there's a genetic information such as DNA sequences or genetic testing results. This type of data is particularly sensitive due to its potential implications for individuals' health and privacy. A fourth type of sensitive health data is information related to individuals' sexual orientation or sexual health, including information about contraception. There are also other types of sensitive patient data where the GDPR applies. This includes data that identifies individuals' racial or ethnic origin as sensitive, as it can be used to discriminate or target individuals unfairly. Information about individuals' religious or philosophical beliefs is also considered sensitive. In some cases, this information may be relevant to healthcare decisions, such as dietary restrictions or end-of-life care preferences. Then there is information about an individual's criminal history. This is sensitive and should be handled with care, especially in the context of mental health or addiction treatment. Thank you for your attention.